माननीय बालाजी तांबे यांचं स्वागत आहे.
The topic of his lecture or presentation is Ayurveda and Mind in Stem Cell Treatment. I request Professor C.R. Luti to begin with his lecture. Thank you.
Thank you very much for being with us, and thank you very much also my friend Acharya of the world, Professor Ranade, for create the Akasha and the space that makes possible this event. You know, Om has thousand of meaning. In Argentina, we found one meaning more, which is Ayurveda Universidad Maimonides. This is our university, and Dr. Goverman is the chairman, also my friends. Wait a minute, I have a problem. I have a problem with this, sorry. South America, with university and college hospital. So we teach over the patient. We have patient and just the course is just for professional, health professionals. I am the last Fabian Ciarlotti, one of the directors of the Maimonides University. This lecture is about how we teach the mind in patients with self-therapy. Could be self-therapy is the mother therapy, the undifferentiated therapy. This is the brief resume of what stem cell therapy is. It's not just stem cell therapy, it's cell therapy because we use lymphocyte, we use a lot of kind of cells. But after the last injection, after the treatment, we began with neurorehabilitation with Boita and Bobat method, but not only Bobat and Boita, but it is a Cuban method because we stay with the patient 6 or 7 hours per day. Since I told the chairman of cell therapy in Maimonides is Dr. Moviglia, our university has one of the best laboratories in the world for cell therapy. We put our university put all the power to cell therapy. Dr. Moviglia is the chairman of the cell therapy, and when I talked to him, when I present him Ayurveda, and he was really appreciated to know Ayurveda, and he said, please join Ayurveda method with cell therapy, because you can do the perfect treatment, but if your mind is in negative position, it's not enough, the treatment. So we began the treatment, we began the Ayurveda treatment with cell therapy. We joined Ayurveda treatment with cell therapy, and usually we follow the Ayurveda law, which is looking at the roga and the rogi. In talking about the roga, which is talking about the disease, the samprapti or the Shatkriya Kalas, we get the patient in the last step, in Veda step. So we cannot do too much with the samprapti. But with the rogi, with the patient, as usually we see this dosha, sudosha, datus, malas, and so on. So ahara, vihara, aujadi, everything is each patient, according to Ayurveda, according to the age, according to the disease, according to the season, according to everything. Also, we perform Panchakarma in our university, and the Panchakarma is, of course, according to the symptoms. We, as Vata disease, because in cell therapy, we treat sclerosis, paralysis, and more Vata disease. So we teach, we performance more Bhakti, Nasya, Abhyanga a lot, and Sirodhara, and so on. But the treatment, this is very important. The treatment had to be viable, feasible, and realizable, because the treatment will perform with the relatives, with the family, with the friends. So we cannot get the relatives fed up with the treatment. So the treatment has to be viable. We cannot perform really big treatment and the patient cannot get it, they cannot catch it. So the very important items is the plan has to be viable, feasible and realizable for the patients. But the target today is not the body, is not the stem cell therapy. The target today, my lecture today, is about the mind. Because now I usually think, I'm here now, really happy. I move my hands, I move my legs. I don't have too much problem. Well, at least everybody has the same problem. But just there, go outside and I have one accident, for instance. Tomorrow, I cannot move my hands, my legs. Tomorrow, just one day to the other way. So watch your mind. Watch my mind. Because you can do the perfect self therapy, perfect ahara, perfect vihara, perfect aushadi. Everything was perfect. But what happened with the mind? We cannot win the mind with the mind. We have to go behind the mind. We have to go behind the thought. It's not just for cell therapy. Patients with cancer, with arthritis rheumatoid, or with chronic disease, there are patient who knows he will have pain all your life. So be careful with the mind. This is really important. So this work is how we teach the mind through the deep philosophy of the Vedanta. We teach Vijaya Vijaya, subject and object. We will talk a few words later. That's why, look at that. Patient could be everything perfect. But if the mind is a negative attitude, it's not enough. And if I have paralysis in my whole body, watch your mind. Well, you know, all chronic disease disturb our psychology, so it's not no news. The mind, you know, everybody knows that the mind can feed up the hill or can stop the hill. The mind can give you to death directly. The mind is really important in every treatment. I usually say the gastritis is not here. The gastritis is here. So, okay. And last year, when I talked to Professor Ranade, as the Acharya said, you know the Acharya, just two words or one phrase, it's a sutra. They say sutra with one another. And I say, why I have to treat the body if everything is the mind? And he said, because when you change your mind, the body will suffer. So it is important to treat the mind, the soul, and the body together. So look at that sutra. We see through our thought. Don't see our eyes. See our thought. That's why they say the thought is the 11 indriya. It's one indriya more. Because we don't see our eyes. See what I'm thinking of this. So we teach the way from the material to subtle way, to go behind the thought. Because I usually say, here, everybody, stop thinking. Just for 1 second, 1 or 2 seconds. Stop thinking. Where is your problem? What is your problem? Which is your problem if you stop thinking? So the problem is the thought. And we teach that we are not the mind, we are not the body. We teach that to the patient.